Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the drugs for erectile dysfunction. What is erectile dysfunction or ED? Erectile dysfunction is the inability to maintain penile erection for a successful sexual intercourse. There are many causes of erectile dysfunction. It may be organic, psychogenic, iatrogenic, may be caused by many drugs like antidepressant drug, sedative hypnotic drug, may be caused by antihypertensive drug. So many drugs may cause erectile dysfunction. Spinal cord or brain injury may also lead to erectile dysfunction. Okay, or it may be as a sequel to prostatectomy. After prostate surgery, we may have erectile dysfunction. There are 4 PDE5 inhibitor, phosphodiesterase 5 inhibitors. These are Sildenafil, Vardenafil, Tadalafil, and Avanafil are approved for the treatment of erectile dysfunction or ED due to organic or psychogenic causes. So these are approved by FDA in the United States of America. All of them increase the flow of blood. All of them increase the flow of blood to the sinusoids. Sinusoids are dilated capillary in the cavernous spaces of the corpora cavernosa of the penis. Okay, at sexual stimulation. They do not erect penis in absence of sexual stimulation. So there is no sexual stimulation, there will be no erection of penis. So what is the mechanism of penile erection? So this is the structure of penis, glans penis. This is one of the corpus cavernosum, other side another one. This is corpus spongiosum. The sinusoids are present in the corpus cavernosum here. This is the corpus cavernosum one, another one is this. This is the corpus spongiosum containing the male urethra here. Okay, and this corpus cavernosum is covered by tunica albuginea, and we have also other fascia here like that of Bach's fascia and dorsal fascia. So how the penis erect? Once there is sexual stimulation, blood flow will come to occupy these spaces. These are sinusoids or cavernous spaces. Okay, this is the central artery of the penis. Another one is here. So this will be dilated. These spaces will be dilated. Smooth muscle around them will be relaxed. So there will be excess blood will go there, all the spaces, and that will lead to erection of penis. What happened? Production of nitric oxide, source of nitric oxide from the endothelial cells of the body, activity of guanylyl cyclase. There will be increased production of cyclic GMP, and this medication, this 5-HP inhibitor, they prevent the inactivation of cyclic GMP. So cyclic GMP will stimulate the smooth muscles of the corpus cavernosum. It will increase the blood, then there will be increased blood flow, there will be erection of penis. So this drug, this 5-HP inhibitor, they prevent the inactivation of cyclic guanosine monophosphate. Then these all will be increased. So there will be erection of penis. Sexual stimulation causes the smooth muscles of the arteries to relax. more blood flows through the sinusoids. These are the sinusoids. There's connection from the central artery of the penis to the sinusoids. Okay. More blood flows through the sinusoids, the penis is swollen and erected. And its erection should be sustained due to the contraction of the tunica albuginea and the Bach's fascia and the Dartos fascia. Okay, they will keep the blood in these spaces. Okay, on stimulation for sexual activity is over, then blood flow will not go to the spaces, so then the blood will go back through the venous channel. Okay, so this is the mechanism of penile erection. It needs sympathetic function, parasympathetic function, and local somatic sensory function like that of the pudendal nerve. Okay, it also needs the blood vessels so that the blood can flow properly. Okay, drugs for erectile dysfunction. Okay, we have 4 drugs that is approved by FDA. This is the new one. Initially these 3, then this is added. So these are the drug, this is the trade name or commercial name. These are the trade name, these are the generic name. Okay, so time to peak concentration: Sildenafil 60 minutes, Tadalafil 120 minutes, and Vardenafil 50 minutes. Avanafil, the new edition, its market name is Stendra. Its time of peak concentration is earlier, 35 to 45. Half-life is around 5 hours. And food interaction, almost all of them has food interaction. Less food interaction with that of the Tadalafil or Cialis, the market name, or the commercial name or trade name, or ad circa. It has less food interaction. Others has food interaction, avoided to get the fatty meal along with this medication. Only this is exception, Tadalafil. It will cause less problem, less food interaction. All of them are 5-phosphodiesterase inhibitor, equally effective in treating erectile dysfunction. Well, the acceptance depends on the person who is taking the medication, his physique, his requirement. Okay, but all of them are effective. Are taken orally by mouth. Side effects profiles are similar. So advantage of this drug, it can be used orally. Our old drug or system was that of injection to the penis. Old drug also need to be taken on the surface of the penis inside the urethra, maybe injection, and even surgery was practiced previously, the splint surgery inside the penis. Okay, so this is more convenient. This drug like Sildenafil, Tadalafil, Vardenafil, Avanafil, all can be taken orally. There are different doses that should be checked and controlled by the physician. Physician will check the patient and they will decide how much dose should be taken. But none of this drug should be taken more than 1 time a day, even the small dose. Pharmacokinetics, what happens to the drug? Sildenafil and Vardenafil are similar. Sildenafil and Vardenafil are similar. Both of them should be taken 1 hour prior to sexual intercourse. Erectile improvement is observed up to 4 hours after administration. Avanafil is a new drug that has a quick onset of action, 35 to 45 minutes. So it can be taken 35 to 45 minutes prior to sex. It has fewer visual side effects, but this old drug, Sildenafil, has more visual side effect, especially color defect, than that of Avanafil. So we have to remember that sex should occur within 1 to 5 hours if we consider these three drugs: Sildenafil, Vardenafil, Avanafil. Absorption of all three drugs are hampered by fatty meal. This is exception. Tadalafil has a slower onset of action, longer half-life around 18 hours, action for 36 hours, and is less affected by food or alcohol, almost nil. Alcohol is a vasodilator. Alcohol should be avoided with all type of anti-erectile drugs. Okay. All of them are PDE for phosphodiesterase 5 inhibitor metabolized by cytochrome P453A4 enzyme that is present in the liver and have the potential to interact with many drugs, maybe over 284 drugs, because they use the same enzyme system of the liver for metabolism. Adverse effects include headache, flushing, dyspepsia, nasal congestion, hearing loss, blurred vision, dry mouth, severe postural hypotension. Patient may go through fainting, they may have profuse sweating, tachycardia. Priapism is an adverse effect, very serious condition. This is painful erection of penis for more than 4 hours. Painful erection of penis for more than 4 hours. And this drug may develop eventually tolerance to certain extent. Disturbance of color vision, blue and green discrimination. So there may be problem in the cones in the retina with probable inhibition of PDA, phosphodiesterase inhibitor 6. So usually all of them are phosphodiesterase inhibitor 5, but some of the drug also has some effect on PDE6 like Sildenafil, even the Avanafil. Okay, so maybe to less extent the new drug, but both of them may affect the cone. Those are essential for blue and green discriminatory vision that is disturbed, okay, by this drug, the Sildenafil and the Avanafil. Okay, 5 diadoxys 5, the phosphodiesterase phosphodiesterase 5 inhibitor do not increase the incidence of myocardial infarction, but this is not always true. If the dose is very high, if the person's heart is weak, heart has some ischemic condition like coronary artery disease, then it may cause myocardial infarction. That is possible. Usually in a healthy person, heart is good, it will not cause myocardial infarction. Phosphodiesterase 5 inhibitor should not be taken more than once a day. Okay, drug interaction, very important. Phosphodiesterase inhibitor 5 should not be taken with nitrate, like nitroglycerin or any other nitrate. It is a contraindication. They are vasodilator, so there will be huge postural hypotension. Also, it is contraindicated to take alpha adrenergic antagonist used in prostate benign hyperplasia. It is this drug and the phosphodiesterase inhibitor 5. This is E. Okay, this is E. Phosphodiesterase inhibitor is a contraindication too. Only tamsulosin, that is also alpha adrenergic antagonist, may be used safely with Tadalafil. All the drugs metabolized by cytochrome 450 3A4 enzyme system of the liver, because we know that all the drugs are metabolized in liver, have the potential to have drug interaction with 5-phosphodiesterase inhibitor. A lot of drug, maybe around 284 drugs. These are very common. Rifampicin, phenytoin, cimetidine, anti-sedative drug. They may interact with the anti-erectile drugs, like against the 5-phosphodiesterase inhibitor. A long list of drugs. These are only a few. Advised to avoid alcohol and fatty meal. Important. And please avoid grapefruit juice. That may induce the liver enzyme, may cause a lot of drug and food interactions. Okay, so that's all about the pharmacology of the drug used for erectile dysfunction. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.